Hello class, this is your first of 4 lectures on blood vessels and hemodynamics. In this lecture we're going to talk about, well, first of all I'm going to review the types of blood vessels that are found in the body. Basically I'm going to start with an overview of the types of arteries that you have and characteristics of them, as well as characteristics of capillaries, venules, and veins. Of course, these blood vessels are responsible for providing the route for transporting nutrients and oxygen to the tissues. And they also provide the route to remove waste products from the tissues. We also have already learned that there are many substances dissolved in the aqueous solution, plasma. In addition to nutrients and waste, we can find chemical signals like hormones. So as I said, this is going to be 4 installments, and in this first installment I'm going to review the anatomy of blood vessels. This should be hugely review. And then I will also talk about how we can apply Ohm's law, which I introduced in our neurophysiology unit, to the cardiovascular unit, where it's the same equation. How flow, in this case blood flow, is dependent on a pressure gradient and inversely related to resistance. Then in the other installments I will talk about how blood flow is regulated intrinsically by the surrounding tissue. Autoregulation is a better term for that, as well as how the nervous system can augment this and the endocrine system. And then towards the very end of our lecture you're going to learn about the Starling forces and the hemodynamics that at play across a capillary bed. So to begin our lecture, let's first start with arteries. The definition of an artery is a blood vessel that carries blood away from the heart. You cannot say that the definition of an artery is a blood vessel that carries oxygen-rich blood, because that's not always the case. For example, the pulmonary trunk and pulmonary arteries carry blood away from the heart, but they are carrying blood away from the right side of the heart, and this blood is oxygen poor. So, strictest definition, arteries, think A for artery and A for away, carrying blood away from the heart. Now, arteries typically have 3 layers known as tunics. Tunica intima is the most internal layer, facing the blood. This is simple squamous endothelium, and endothelium is a special type of epithelium in that it has a free edge, the edge that faces the blood, of course. Then there is an internal layer called the tunica media, and think M for media and M for muscle. The tunica media is really a layer or layers of smooth muscle. And it's this layer where the smooth muscle can constrict and cause vasoconstriction, or relax and lead to vasodilation. And this muscle contraction or relaxation is targeted by chemical signals released by the surrounding tissue bed, or it can be targeted, or it can be targeted by the sympathetic nervous system, which we learned in Unit 2. The most external layer is the tunica adventitia, or tunica externa as it's called in some textbooks. This basically is connective tissue, and it has collagen and elastin arranged in a longitudinal fashion. So take a moment please to familiarize yourself or refamiliarize yourself with all of these layers. Now I'm going to go through the blood vessels vessel by vessel type and tell you about their specific characteristics. Let's first start with the largest arteries that are closest to the heart. These are called elastic arteries. Now, why are they called elastic arteries? Now, if you take a look at this picture, on the bottom right you can see the elastic artery. And what I want you to know is these blood vessels have a lot of elastin found in their vessel walls. In particular, elastic arteries actually have elastin fibers within their tunica media, literally interwoven in between those smooth muscle cells. This allows great distensibility. The blood vessels can stretch because, of course, the heart is ejecting a large bolus of blood, a large stroke volume, about 70 milliliters on average. So they need to be able to distend, but as we've already learned in class, the most important part of elastic fibers is not their ability to distend, but to recoil back. Now, these blood vessels don't have a lot of resistance associated with them, so there's good blood flow going through them. Again, great ability to distend and then recoil. And this recoil property is very important because it's going to make sure that blood continues to flow even when the heart is relaxing. And I'll expand on this more in a later segment. Now, of course, the elastic arteries are going to lead to muscular arteries. Again, arteries are taking blood away and they diverge, they branch out. So the next set of arteries we see are muscular arteries, and they are called this because they still have elastin fibers, but they are arranged in layers or sheets around the muscular layer, around the tunica media. So there's an internal lamina and an external lamina. Don't let the word lamina frighten you. It simply means a sheet of elastin fibers. And if you're looking at the bottom picture here for the muscular artery, you can see that there are two distinct layers where you see the blue color. And again, those are to represent these sheets of elastin fibers. Now, these muscular arteries serve organs, not just your muscles, but other major organs, like, for example, the gastric artery serving the stomach is a muscular artery. These arteries have a thick tunica media, and therefore they can constrict and therefore regulate the amount of blood that is flowing or supplying a particular organ. Now we're getting to the smallest arteries, the arterioles. And in these pictures, you're seeing an arteriole leading to a capillary bed. Arterioles are called our resistance arteries. They have a very thick tunica media compared to the diameter of that blood vessel. So if we were to take all the blood vessels and compare the size of their lumen, the diameter, compared to the thickness of their tunica media, arterioles have the largest ratio of this. So lots of tunica media compared to their diameter. Most certainly they're going to be the target by local signals from tissue beds and the sympathetic nervous system to cause that tunica media to either constrict and reduce the amount of blood flow to a particular tissue bed, or relax and vasodilate and allow more blood flow to a particular tissue bed. Now, in these pictures, you're seeing an arteriole branch off to a medarteriole. And the medarterioles, they are surrounded or adjacent to bands of smooth muscle called precapillary sphincters. And in the top picture, you're seeing a capillary bed being well perfused. The precapillary sphincters are relaxed and allowing blood flow to go through the entire capillary bed. But when precapillary sphincters contract, they are then going to shunt blood through the thoroughfare channel shown in the bottom right picture. Now, these precapillary sphincters, they are going to be under the control of local tissue factors. It's really a beautiful system. You see, if the tissue has adequate nutrients and oxygen, then there's no need for continuous perfusion of that tissue bed. The precapillary sphincters will constrict and shunt the blood through the thoroughfare channel. If, however, the tissue bed requires more nutrients and oxygen to be delivered, the precapillary sphincters then relax and the capillary bed is well perfused. Now, again, we are going to see these precapillary sphincters contracting or relaxing under the command of local chemical signals released by the tissue bed. It is a beautiful system, and before I get there, let me just give you this to think about. Let's say you're tapping your big toe now listening to my lecture. Does it make sense to have your heart rate increase just to increase the amount of blood delivered to your big toe, which is clearly more metabolically active because you're tapping it up and down. It doesn't make sense to have the heart work harder just for one localized area of the body that might need more blood flow. Rather, the local tissue bed should dictate its own perfusion of its capillary bed without having the heart work harder. And I will expand on that in a later section. Finally, we're at the smallest blood vessels. These are the capillaries. Now, pay attention. In the previous slide, I said arterioles were the smallest arteries. Capillaries are the smallest blood vessels. They are very simple in their anatomy. They have a single layer of endothelial cells, and then they have a basal lamina, basically a sheet of connective tissue on the outside of this endothelial layer. This is the thinnest possible diffusion membrane, and capillaries are called our exchange vessels. You have over 10 billion of them to serve the tissues of your body, and most cells in a tissue bed are only about 20 to 30 micrometers away from a capillary. This means most of the nutrients and gases and waste have to be able to diffuse from the capillary bed out to the cells, or from the cells into the capillary bed. And every cell needs to be in close proximity for that to happen, because we've already started to learn a little bit about Fick's law. The rate of diffusion is somewhat dependent on the distance that the solutes have to travel, of course. So we have billions of capillary beds, and in the bottom right picture you're seeing a support cell called a pericyte that is stabilizing the capillary beds. Now, there are different types of capillaries, and I'd like to discuss them right now. 3 main types: continuous, which is the most abundant type, but it's least permeable when we talk about all 3. Then there's fenestrated, and fenestrated for our class, we're going to focus on fenestrated capillary beds in the kidney. That's not the only place you find them, but it's a great place to focus our attention. Then the most permeable but least common are the sinusoidal or discontinuous capillary beds. Now let's look at a continuous capillary bed shown up here in the top right pictures. Continuous capillary beds have intercellular clefts. These are basically gaps in between the endothelial cells that allow diffusion of substances. We also can have substances moved across the capillary cell membrane by exocytosis and endocytosis. So again, these are the most abundant types of capillary beds, and the reason why they're called continuous is because the basal lamina is continuous across the endothelial cells, wraps around it. Now, fenestrated capillary beds are shown down here in the bottom right picture, and hold on, strike that. Fenestrated capillary beds are going to be found on the next slide. I'm going to show you a picture of it. Down at the bottom right picture, you're seeing an example of a sinusoidal or discontinuous capillary. It has fenestrated endothelial lining. That means large gaping holes in the endothelial lining. But also, the reason why it's called discontinuous is the basal lamina is not a complete sheet of this protein layer. So it's an incomplete. And we find this most abundantly in the liver and spleen and bone marrow. And in particular in the liver, it allows hepatocytes to have a great access to the blood that's flowing inside that vessel, that capillary bed. And of course, hepatocytes are responsible for detoxifying our blood. So we want them to have easy access to the blood inside. Now, as I said on this next slide, I'm showing you a picture of a fenestrated capillary. Now, fenestrated, there still is the basal lamina layer. It's like a sheet of membrane. But you're seeing the many gaping holes going through the endothelial cells. This is going to allow rapid filtration of your blood plasma, particularly in the kidney. And we will discuss the anatomy of these fenestrated capillaries again when we get to Unit 4. Now, after a capillary, we of course have venules, which lead to larger veins. Veins are called your capacitance vessels, meaning at any given time about 60 to 70% of your whole blood volume is found in the veins. They do have all three tunics. They have the intima, tunica media, and tunica externa. However, their tunica media is not very robust. It is very thin, and they do have a thick tunica externa. And in addition, veins have pocket valves, and you're seeing a little animation here. As your skeletal muscle contracts, it squeezes on the blood inside a vein and helps push it back toward the heart, even defying gravity in the case of blood vessels returning blood through veins back to the heart that are found in your legs. So when the skeletal muscle relaxes, there's a temporary regurgitation or backflow of blood, as shown in this animation. But the backflow of blood fills these pocket valves, and then they close and prohibit any further regurgitation of blood. Now, of course, these valves can fail, and this leads to varicose veins, as shown down here in the bottom left picture of the lady's legs. Valves can also fail and present with bulging veins in in certain types of veins that are found in our rectum, and of course these bulging veins are called hemorrhoids. One more thing before I move on is that these valves favor the one-way flow of blood back up to the heart, but again, because veins don't have a very thick tunica media, they can't really provide a great vasoconstriction type force on the blood inside to propel the blood back up to the heart. Therefore, we rely heavily on our skeletal muscle, quote, pump and respiratory pump. Literally, the inhalation and exhalation helps pull blood up from lower regions of the body and into the right atrium and left atrium. So veins are considered capacitance vessels in that they have a great ability to expand and store a large amount of blood. And the reason why they can do this is because they don't have a great amount of contractile force from their tunica media, which again means we're going to have to rely on other types of, quote, pumps in order to get the blood back up to our heart. Now, what do I mean by distensibility and capacitance? Because these two terms are not necessarily they are not the same. So vascular distensibility is basically the fractional increase in volume for each amount of pressure times the original volume. Now, I don't want you to worry about this actual definition, but I want you to understand this. Distensibility versus capacitance. Okay, so how distensible is a balloon versus how distensible is your garden hose if you were to blow into them with the same amount of pressure? I'm sure you would appreciate that a balloon is more distensible than your garden hose. Well, let's talk about balloons then. Have you ever tried to blow up with your air, your personal air, a water balloon versus a traditional air balloon? Now, which balloon of those two types is the most distensible? And I'm sure you would agree a traditional air balloon is more distensible. So veins are more distensible than arteries. They're about 8 times more distensible. Capacitance means how much of a volume do you get for every increase in pressure in millimeters of mercury. And so basically what that means is, let's take a balloon analogy again. If I were to blow with half my force into a traditional air balloon and blow with half my force into a water balloon, try and visualize how much each one would distend. Now, if I were to blow, taking those same balloons, with my greatest force into both of them, the regular air balloon would expand much more for that given increase in pressure. So in the end, what I want you to know is this. Veins, because they don't have a thick tunica media, they have a lot of connective tissue, especially elastin tissue. They have 8 times more distensibility than arteries, and they have 24 times the capacitance. That means they can really expand their volume for any given increase in pressure. Now, as I said before, I'm going to introduce to you how Ohm's law can really apply to the cardiovascular unit. Now, Ohm's law in lecture unit 2, our neurophysiology, dealt with flow of ions. And the flow of ions was directly related to the concentration gradient of those ions across the cell membrane. And I wrote down the physics equation for current, right? And we also learned that this flow of ions was inversely related to resistance. And we talked about the forms of resistance in neurons. Closed channels, right? Gated channels. We also talked about how myelination decreases resistance. So how can we use Ohm's law to apply to blood flow? Well, we need to modify Ohm's law a little bit using different letters. Flow in this case is symbolized by a letter Q, and it should have a dot on top of the letter Q. So blood flow through a vessel is determined by, there has to be a force, a pressure gradient. If there isn't a pressure gradient where one side of the blood vessel has a higher pressure and the other side has a lower, then blood won't flow. If there's no gradient, there is no flow. Then there is an inverse relationship between resistance. Now if you're looking at the Colorado River here going through Grand Canyon, you can see there are some types of resistance. You're seeing little sand beds in the middle of the river. You can even see some rocks where some rapids are, and some twists and turns through the canyon. So anywhere where resistance is high, flow is going to be impeded. So an inverse relationship. Now the game you should play for this lecture is, if you know 2 of these values, could you predict the third? And soon I'm going to assign for you a PhysioX where we will play with that type of concept. What will happen to flow if resistance doubles? What will happen to flow if pressure doubles? We're going to talk about those types of concepts. Now, blood flow blood flow needs units, and the units are liters per minute or milliliters per minute, but it's a quantity of blood that is flowing through the vessel in a unit of time. So here is a picture of my husband, and he's fishing in the Colorado River, and I am sitting on the side and I'm watching this great quantity of water flow in front of me. And as I sat there for 20 minutes watching him fish, I was trying to figure out how much water actually had gone by in that 20 minutes. So again, blood flow is a quantity of blood in a unit of time. Flow is going to rear its ugly head in many forms for us in this unit. For example, cardiac output, the amount of blood that flows out of the heart in a unit of time, is an example of flow. So there is an equation, actually there's more than one equation, that we use to calculate cardiac output. The simplest of them is heart rate times stroke volume. Now, if you look at the bottom bullet here, a typical heart rate is about 70 beats per minute. And as I already told you, a typical stroke volume is about 70 milliliters of blood ejected with every beat. And our math tells us that the beats in this case will cancel out, and we're left with milliliters over minute. So we have a cardiac output of roughly 5 liters per minute. And again, that's the units for flow. Now, what are the ways blood flows? Usually blood is going to flow in streamline layers, and this is called laminar flow, shown here at the end of my blue arrow. There's a bit of a parabolic effect with laminar blood flow, where the middle section of this blood flow flows with a greater velocity than the blood that is coming into contact with the endothelial layers. There's more drag, and I'm sure you can appreciate this when you think about cyclists or geese flying, or even the NASCAR races, where in the case of the geese, you know, the ones that are up in the front, they are experiencing more drag, and the ones in the back get to take more of a break, and then they rotate. Well, in this case with blood, it's kind of the reverse. The blood cells in the center of the pack actually experience less resistance, so they get to go faster. And the blood cells that are in contact with the endothelial lining, kind of tumbling along, they experience more resistance. So that's why we get this parabolic effect. Now, that's how blood is supposed to flow, laminar. But blood can also experience turbulent blood flow. We see turbulent blood flow in our body anytime there are sharp changes or turns in blood vessels. For example, the descending abdominal aorta, one of the branches coming off that aorta is the renal arteries, and they come off at almost a 90-degree turn. That would be an area where there would be a lot of turbulent blood flow. There is also turbulent blood flow anytime blood vessels have rough surfaces, maybe atherosclerotic plaques. We see turbulent blood flow anytime there's rapid narrowing of blood vessels, and when blood is flowing at high velocity. Now, this is important for lab as well as lecture. Laminar blood flow is silent. Turbulent blood flow leads to murmurs or bruits, sounds. And in fact, when we get to this lab portion, you're going to learn how we can actually use these murmurs to determine a patient's blood pressure. And you will also learn how silence plays a role in determining a patient's blood pressure. So again, laminar flow, no sound. Turbulent flow, there is sound. What about no flow, shown here in picture A? Again, if there's no pressure gradient, blood cannot flow. So no flow also means no sound. All three of those concepts will be very important concepts that you master when I teach you about determining a patient's blood pressure. All right, last slide for this first segment. Anytime you have blood vessels experiencing a large amount of turbulent flow, this can lead to a lot of stress on the vascular wall. Now, typically endothelial cells have a natural defense to turbulent flow in that they can release nitric oxide. I'll remind you that's a neurotransmitter that's made on demand. And the nitric oxide causes produced by the endothelial cells causes the tunica media to relax. And therefore, this should allow blood to be less turbulent and go into a more laminar fashion. If blood vessel cells cannot perform this duty, then vessel walls get stressed and they might bulge out, they might get weakened, as shown here in this aortic aneurysm. Or they can actually start having mineral deposition, like calcium deposits and plaque synthesis, and become more rigid, like shown here in this blood vessel that has atherosclerosis. And you can see the white streaky plaques inside the vessel wall. This is something that we obviously don't want to happen, so it's very important that laminar flow be the primary way that blood flows through blood vessels. In the next segment, we're going to talk about pressure gradients and forms of resistance with respect to blood flow and Ohm's law.